Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about the SIBO diet. Before we dive into the SIBO diet, here's a quick reminder of what SIBO is. SIBO, or small intestinal bacterial overgrowth, is a condition that occurs when bacteria that are supposed to stay in the large intestine or colon begin to travel up into the small intestine. This bacteria then begins to feed on our food in the small intestine, creating a fermentation process that can lead to significant symptoms such as bloating or gas, especially after eating, abdominal pain, constipation, diarrhea, heartburn, indigestion, nausea, fatigue, brain fog, malnutrition, sense of fullness after eating, and more. The goals of a SIBO diet are to reduce fermentation in the gut and help alleviate symptoms. The SIBO diet works by removing foods that would typically feed opportunistic bacteria in the gut and promote fermentation. The most common SIBO diet recommended is called the Low-FODMAP diet. FODMAP stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These specific carbohydrates are known to feed microbes within the gut that cause fermentation and lead to symptoms. So what foods should we avoid on a SIBO diet? The most common talked about food category to avoid is called high FODMAP foods. High FODMAP foods are foods such as grains like wheat, rye, barley, dairy like milk and soft cheeses, legumes such as beans and lentils, certain vegetables like onions, garlic, and cauliflower, fruits high in fructose like apples, watermelon, and bananas, and sweeteners like high fructose corn syrup and honey. Here is a more comprehensive list of high FODMAP foods. Another category of foods to avoid while on a SIBO diet are processed and inflammatory foods, such as processed sugars, artificial sweeteners, alcohol, fried foods, and more. So now that we know some of the foods that we should avoid, what foods should we eat? The first category of foods on the approved list are low FODMAP foods. Foods that are low in FODMAPs are foods such as proteins like grass-fed beef, pasture-raised chicken, turkey, eggs, certain vegetables like zucchini, spinach, and bell peppers, fruits lower in fructose such as berries and citrus fruits, healthy fats like olive oil, coconut oil, avocado oil, or even avocados in small amounts. Here's a more comprehensive list of low FODMAP foods. On a side note, even though certain grains are considered to be lower FODMAP, we commonly remove all grains from the diet because they can be inflammatory triggers for the gut. Another group of foods that are approved on the SIBO diet are gut-supportive foods, such as bone broth, fermented foods, if you tolerate them well, coconut products, and more. So what's the best diet to be on if you have SIBO? There are several dietary options that fall under the SIBO diet, such as low FODMAP diet, the elemental diet, the SCD or specific carbohydrate diet, and the low fermentation diet. So what is the approach to the SIBO diet at Restorative Health Solutions? After taking a thorough history, we then look at the individual patient's test results and make specific dietary recommendations. The tests we use to help make the dietary suggestions are food testing, such as genetic testing for gluten sensitivity predisposition, food allergy panels, and food sensitivity panels. And we also look at the test results of the microbiome or the stool test when considering dietary recommendations. As always, be sure to consult with your healthcare practitioner to find out what diet is best for you. Well, I hope you learned a little bit about the SIBO diet today, and until next time, I'm Dr. Paul.